If you have an injury to the neck or upper back, for example whiplash, or you're spending long time sitting in front of the computer and getting so-called office syndrome, or you suffer with chronic debilitating pain in the muscles like fibromyalgia, FlexBeam can assist you in your recovery by stimulating blood flow and easing tight muscles. Choose preset 2 for targeting muscles of the back of the neck and preset 3 for any other places in the upper back. Get yourself comfortable. Place the FlexBeam on the area where you feel the issue first. If your issue involves the side of the neck, you can start by applying the FlexBeam on that side using preset 2 or 1. Then focus on the opposite side. In case of an ongoing pain, add one more position, placing the FlexBeam across the upper back on preset 2. If the issue is recent, use the FlexBeam for 20 to 30 minutes daily with the weekend off, and if the issue is ongoing, use FlexBeam for 30 minutes every other day for 3 to 4 weeks, followed by 1 or 2 weeks off. The effect is cumulative, but you can stop when you're happy with the results.